our 47th Congress continued to work. We are going online, and thank you very much for those of you who is already online. It's nice to see Alfredo. It's nice to see Daniel, our keynote speaker, is here. Nice to see whom I know. Anna Maria Rosa, good morning, Argentina. John.
Hello, how are you?
We are fine. Joel Donchin from Israel, our friend, is also here. And I would like from Greece, a lot of people from Russia, from China. So we are going online. Actually, during yesterday and today, more than 50 people has registered, and probably they will add our conference very soon. So what we are doing a little bit more than months since the virtual opening of the Congress. So our association is alive and everything is happening. And today we try to start a new, like a pilot project. And what we will do, we will provide the first online lecture. As you remember, in the Congress program was the topic history of medicine beyond the borders and behind the curtains. You know, in the last day of the conference, we expected a keynote lecture, Professor Daniel Healy, with the lecture, The Notebook of Gulag Doctors Medical Service in Stalin's Labor Camp. It's great that he joined us today, and I believe he will join us in Real in August 2021. And after the keynote speaker lecture was expected the panel discussion moderated by Professor Florian Steger from the University, member of our society, on the topic medicine and totalitarismus. Okay, what we have done for today, we are a little bit in compromise variant, because during the summertime when it was break from the COVID, when the European Union was open, we met actually Professor Florian Steger, I see Dr. Marcin Orzechowski, experts from Latvia, Ineta, Lipša. Ineta, greetings to you. Ineta, yeah. Maie Toomsalu from the Tartu University, and somewhere I have seen Aistis Žalnora from the, already here on screen, yeah, Aistis is here, from the Vilnius University, because with the sponsorship of and grant from the Baltic-Deutsch Hochschulkantor institution, we started to work on the topic politicized medicine. And what we have decided is that to involve also you in this project and connect it with our society, we decided to start with let's say, pilot 2 lectures today and on 22nd of October. So it will be kind of test how we can work online. And if the topic will be interested, so the floor is open, you can suggest your topic and we will develop this topic at least how long we need, and then we can switch to another topic. For example, many interested in the history of pandemics and epidemics. But okay, I will be not so long in my talk today as on virtual opening, but I will introduce the key speaker for today. And I see that the Florian Steger, professor from the University Institute for the History of Medicine and Ethics, is online. And we will do kind of compromise. Actually, when we met in Riga in August, we discussed this project with Ineta, with Aistis, with Maie, and Marika is here also, she participated. And we even tape recorded a few lectures. Today we will start with Florian Steger lecture. Actually, it will be recorded already lecture in Panopto format, so you do not need to do nothing, just I will start to share the screen. If you have some issues with the connection, in the chat you will find the link exactly for the same lecture. And after the lecture, of course, we will post on our Congress webpage the record of our today's plenary lecture. So I think it's time for me to start to share my screen.
Ladies and gentlemen, dear colleagues, I would like to give a lecture today about politicized. This is my general topic today, and in fact I would like to talk about an example of politicized medicine, and you can also read it here on my chart. It is about closed venerology wards in the eastern part of Germany, in the German Democratic Republic. After the end of World War II, there was the needness of combating venereal diseases. So, in the Western occupation zone, certain buildings, certain institutions have to be built up, like hospitals for venereal diseases in Hessen or in Hamburg, or so-called penicillin stations, for example, in Bavaria or in North Rhine-Westphalia. But we have a similar situation also in the Soviet occupation zone, but the terms are different. So it's worth to concentrate also on language and technical terms. There the names are reformatories, for example in Dresden, in Leipzig or otherwhere, or we call them, or they were named, closed venerology wards, for example in East Berlin or in Cottbus or in Eberswalde. If you follow my charts, you will see at the bottom some papers we wrote about this topic. So if you get closer to the charts, you will find also my sources. Sometimes it's written by me, in fact, and my team. What about the legal basis in the Soviet occupation zone and also in the GDR? And it is quite interesting because the starting point is in 1927 Weimar Imperial Law. It was the law on combating venereal diseases. There was a compulsory treatment in hospitals in the 1920s and 30s in Germany already. And this Weimar Imperial Law was valid in the Soviet occupation zone until 1947. Then things are different, and there's the spirit of Soviet Union there. In the western part, in the Federal Republic of Germany, it was still till 1957, this Weimar Imperial Law, and then it was only renamed, but it was the same. So if you look in the second part of 20th century and combating venereal diseases, you have the legal basis in the western part of Weimar Imperial Law. Completely different to the eastern part of Germany. There we have this spirit of Soviet Union and also this spirit how to deal with venerology diseases. There you have this regulation on combating venereal diseases in 1947 in German population in the Soviet occupation zone. And there was a compulsory treatment in a closed facility. And this administration order was valid until 1961. So the legal basis in eastern part of Germany came up from Soviet Union. In 1961, they talked and discussed and wrote something special in the GDR for their own, and it is called the Regulation for the Prevention and Control of Venereal Diseases in 1961. So what we can learn, in eastern part we have completely different legal situation, which has a lot to do with the spirit of Soviet Union. And this is why the history of the western part of Germany in the second part of 20th century and eastern part of Germany is completely different. And you can see there, paragraph 20, there is a compulsory commitment in a multi-stop procedure foreseen, first as an ambulant one with free choice of a physician, then a stationary one, and third in closed venerology wards. This was a step procedure there in the eastern part of Germany. So we have this tradition in eastern and western part of medical care for individuals with venereal diseases. But in the GDR, the medical care was combined with educational intentions and concepts. Maybe there is more education than treating persons. And I call this politicized medicine, and you see also my monograph. I wrote about this in 2016 in German, Traumatisierung durch politisierte Medizin, traumatized in fact of politicized medicine. What does it mean, politicized medicine? And I give you a definition. Physicians and nursing staff did not simply adopt norms imposed by political system or were instrumentalized by them. Rather, they are shaped the political system through their individual norms and actions, which they applied in their everyday praxis. So, in fact, they are also politicians as medical doctors and as healthcare workers. This is my thesis, which is very important for me doing this research on politicized medicine. So, how do I work? I have two approaches. One approach is oral history. So I did many interviews with contemporary witnesses, with female patients, but also with doctors, with physicians, with nursing staff, with policemen, members of the administration. And on the second part, I concentrated on historical critical analysis of printed and photographic sources. And if you go here through the chart, you will see I started very regional in Halle, nearby Leipzig, and then I found more and more and more, and we have now national archives who are full of this historical archive. So many people can work of this topic if they are interested in. My first book about this topic was only about Halle, nearby Leipzig, and it was only about one polyclinic, the Polyclinic Mitte in Halle, and there was a closed venerology ward in this polyclinic built up in 1961. And it was part of district hospital in Döhlau, and you can see that only in 1 year, only in the year 1977, there were 235 compulsory commitments. So it ran around about 20 years, this ward. So approximately we talk about 5,000 female persons who were alone in this ward in Halle, nearby Leipzig. I found there a closed ward as a part of the polyclinic with closed doors, barred windows, bare walls, no pictures. Round about 30 patients were there on the station. Several patients had one room, then there was a day room, an examination room, a room for administration, some sanitary facility, and most prominent also in the narratives of the witnesses, of the contemporary witnesses, is most prominent narrative. If you do oral history with these witnesses, there is a chair for gynecological examination. Who was in these wards? First of all, these were women, not men. And which women? Girls and women between 12 and 72, in average round about 22 years. Second very important result of our research is that these women are not infected with venereal diseases. only if you look here on the chart, you can see there some citation from Gerd Münx. Gerd Münx was responsible for the closed venerology ward in Halle. He wrote in 1979 that he found in 1977 that 30% of the inmates were diagnosed by sexually transmitted disease. So more than 2/3 of them doesn't have any or didn't have any venerology disease. Why did they choose these women to these wards? The answer is quite complicated, but it is in fact the right answer. We found this also in the archives and in the records there. The reason for commitment was the unreliability of women. They thought in the GDR that women are unreliable. And if they are unreliable, I have to discipline them, I have to educate them, I have to punish them. And so they decided to send them to these venerology wards. There is only a very small number of men who committed also to these wards. Men in the GDR are considered more reliable than women. So there was no reason for forced commitment. They come on a voluntary basis. But women, you have to force that they get this treatment. This was the idea of GDR, and you can find this in the written materials in the archives. Then we thought, if there are any men, but there's only a very small number, then this will be homosexuals. But in fact, it is not right. Our findings are completely different to this. If there is a man, it is a heterosexual man. And we just published a paper some weeks before about this question here. It is written in German, Männer in geschlossenen venerologischen Stationen, but there's also an abstract in English. And this paper deals only with the questions, why, are there any men? Yes, but only very small. Which men? Heterosexuals. And why there are only women? Because in the GDR, women are thought not to be reliable. This is why they choose women. We had the opportunity to make a case study because the archive of Leipzig, there was also a venerology ward, there are records kept in the archive in Leipzig, and we asked maybe we can have an insight into these archives. I did this many times in different cities in Germany, and most of them said no. You are not allowed to get to these records. We are not interested that you write this story about politicized medicine. Again, it is a topic of politicized medicine. So I'm really lucky and thankful, Leipzig, the city of Leipzig, that we had this opportunity to get deeper into patient records. And you can see there are around about 5,000 patient records in Leipzig, and we took a sample because 5,000 is a huge amount, and we decided only to study on 1,241. It's also a huge number of records, and we published this also here in this paper, which I gave on the chart. And this is a typical record here, medical file, what you can see here, and you can see entrance day here, and when they left the ward, so they were there around about 20 days. Then you see here the indication. Why did they decide to send these women to this ward? And it was not because of venerology disease. It was because of this social indication, Herumtreiberin, in English, drifter. So it was a social indication because these women are chosen for this ward. And there, what there happened also in this ward is very terrible. You can see that they made 21 negative smears of gonorrhea. Absolutely stupid matter. It has nothing to do with medicine. It has only something to do with torture, with torturing women. Nobody needs 21 smears to detect gonorrhea or not. You need 1 or 2, or that's it, but not 21. And this is why this is about torture. Here you can also see our result, the reason for commitment, and you will see that in the Soviet occupation zone, in this ward were 68 persons really having venereal diseases, but in the GDR you will see it is only 22%. So there's a shift. Yeah? And the shift is because now the indication is to bring someone or to force someone to this ward is here 52, it is female drifters. It's very important also. There's a shift from Soviet occupation zone to GDR, from the venereal diseases as argumentation basis to female drifters. And another very important point also is these wards have nothing to do with prostitutes. We found only 3% in Soviet occupation zone, but also in GDR, 3% prostitutes. So if there is someone and tells us today a story, they built these stories up because they had a problem with prostitutes. It is completely wrong, and in my opinion, it is also a political message. Yes. And this is why I decided also to write an own paper only about this. There are no prostitutes in these wards. Yeah? These are people who are a little bit different to others. That's all. Yeah? And they are, in general, not ill at all. Yes? They're a little bit different. They are a little bit in a group that behaves in another way than the majority. So how you can come to a ward like this? The committal is by denouncement by a third party, yeah? And the accusation of prostitution. In fact, it's not true. And then you were arrested by transport police for drifting and had the admission to this. There you were undressed, your personal items you have to hand over, they washed your hairs, they cut your hairs, and I think you have now images of a prison, but not of a hospital or a venerology ward. The daily routine exists of early rising up in the morning, 6 o'clock, then daily gynecological examination. They took every day a smear to decide, is it gonorrhea or not? Then you had nothing to do, someone had occupational therapy, but most of the time it was self-occupation in the polyclinic and dinner at night. In most cases, they had to stay around about 4 to 6 weeks. And before they could leave this ward, they had to sign a confidentiality agreement with release. And I expect you are not familiar with this if you think about hospitals, but you're familiar with this if you think about prisons. You have this. You have these political prisons where you have to sign such confidentiality agreements also. So it's very close to prisons. The immediate consequences of detentions are sexual violence during gynecological examination, to cite one contemporary witness, and then the little girl bled insanely, and then the doctor said, so now you had a man. We couldn't understand that. They practically deflowered her in there. Other consequences are sporadic miscarriages on the ward, and then some general symptoms, nausea, diarrhea, vomiting, headache, and so on. We asked also, is there no opposition? If you come from a democratic system like me, you asked, it couldn't be that there is no opposition against such cruel procedures. So we get deeper also in the archives and looked up something, but we didn't find it. And it is caused by the house rules. You see it here also on the right-hand side. These house rules are written by the doctors and the healthcare workers, and they decided to define certain punishments. And these punishments are hardly against any opposition of the patients. So opposition was punished very hard by staff or also by the patients, and the result is there is scarcely any protests by patients, relatives, or health workers, because it's very hard punishment foreseen if there exists any opposition. So it's clear the function is not curing persons, the function is to discipline them. It was education towards socialistic personality. And this was the idea of the GDR citizens since the 1960s. You see here on the right-hand side also the 10 commandments of the socialistic person introduced by Walter Ulbricht in 1958 and included into the party program then in 1963. So what we can find here, there are socialistic norms, and you have to behave in order of these socialistic norms. And if not, then there has to be a disciplining procedure and there has to be punishment. And this is also be done in these closed venerology wards. So what we can find there is prison-like detention in closed wards, strict discipline, moral commitments to socialistic standard. And all what I said today to you was coordinated by the Ministry of Health of the GDR and was under surveillance of the Ministry of State Security. So you can find also in these archives huge amounts of records, and you will find unofficial informants in the district, but also here in, for example, this ward in Halle. I would like to cite this on the bottom here. Münx was the chief medical doctor in Halle. Münx therefore unjustly admits girls to the venerology station of the Polyclinic Mitte. These admissions have no legal basis. He knows exactly who he deals with, so he has extensive experience. And this was a report from the unofficial informant to the government in Berlin. So the government in Berlin knew all about what happened there. And they tolerated this. On the long term and on the long run, there are consequences of trauma also. So these patients have fear of gynecological examinations. Some of them refresh their early childhood sexual traumatization. They suffer from insomnia. They suffered from sexual reluctance. And very bad also, we can also describe in some cases transgenerational transmission of traumatization, so they give it to their childs. So they are not only hurt by themselves, they gave it also already to their childs, and their childs have also symptoms of traumatization. Very well known theory and very well-known history also in psychiatry and in psychotraumatology, but you can find it also in this example. Not only the inmates are infected, they affected, they also give it to their childs, and the childs are also have also these symptoms. To make it clear, it is not a phenomenon of Halle or Leipzig. It is a GDR-wide phenomenon. So you can find these documented all around the GDR, and you see it here in the red spots that it is all around the GDR. So you can find in all these districts here these wards. And what about the number? Quite difficult question to give an answer, so I can only make some sentence about 1 year. I found this in 1968. Günther Elste, who was the head of dermatology in Berlin, he published in 1970 that around about 28% of the inmates had venereal diseases all around the GDR. So it's the same number like Münz. So I think we can learn not more than 30%, I guess less. I guess less were really infected by gonorrhea or something like this. The other one had no venereal disease. To sum it up, politicized medicine has happened in these closed venerology wards in the GDR. This is my example for today, but I could give many other examples in the history of GDR and also beyond. There has happened an education towards socialistic personalities to bring it to the consolidation of political power of the communist regime. This was the goal. There were somatic and psychological consequences in form of traumatization and transgenerational transmission. And very important for us, also for me as a medical doctor, is that there was a regular cooperation of physicians in closed venerology wards with the Ministry of State Security. So there was a regular cooperation between medicine and the state. So my perspective is, and this is why I'm very interested in this topic today also, after writing papers and books about this, to compare it. So the best would be to compare it not only within Germany, Western Germany and Eastern Germany. We did some research already about this topic. The best would be to compare it also to Eastern Europe and to Western Europe. They are all politicized systems, maybe up to now, and we have to compare it to make new results, to compare these results, and maybe also to come to conclusions from a historical point of view. But I'm convinced this is very important also for our daily medical practice and also to beware democracy. Thank you very much for your attention for today.
So we return to our Zoom screen, and thank you very much again, Professor Florian Steger. Maybe first your comments, because as I told, this lecture was recorded in the middle of, or beginning even of August. How it looks, what is your own opinion? And then we will start the discussion. We'll ask you additional questions. Florian?
Yeah, hello, Juris and all other participants today. Thank you very much for joining us. Thank you very much for the opportunity that we can see today my lecture given some weeks before. And I'm also interested in your comments and questions For me, it's a very important topic. I think you saw this already as you heard me and saw my charts. And as I explained, my next steps is really to compare situations with other countries and nations, and also to understand where does it come from. I guess it has a lot to do with Soviet spirit, as I said to you, but also with maybe with other impressions. So this would be my most important interest, or my first interest, to compare it in the next future. I think we understood the situation now in Germany, in Eastern and Western Germany, but I'm convinced that there are comparable situations also in other European, maybe international contexts. So thank you very much, first of all, joining us, and maybe there are some comments or some questions. I could try to give answers to questions.
Okay, thank you, Florian. As if you will open the chart on your screen, you already can find the few questions, comments. So I think today is very interesting audience. We are representing, well, a lot of representatives, let's say, from the Eastern Europe, from all three Baltic countries, Lithuania, Latvia, Estonia. I see Russian colleagues from Russia. And probably also the first questions or comment is from Maria Kuzabayeva from Moscow. A very interesting interpretation of the topic by the author of the message. In my opinion, not all social aspects are affected yet. She's listening carefully. Okay, that is like a comment. Joel has asked you a question. Can you see, Florian, how many doctors participate? And was there any ones that resist or refused, if possible?
Yeah, very interesting question. Thank you for this. I tried also to invite doctors as witnesses for interviews, as a sort of oral history also. I tried to invite them, and some of them also followed my invitation, so I could have a talk with them to understand how it was in their opinion. But we found also materials in the archives who can give answers. And there are a lot of physicians or medical doctors who participated in these medicine, who worked also in these closed venerology wards. And I didn't find anyone who did resistance. So I didn't find anyone who was on the opposite side of this political system. I can remember one interview that some woman who is also today a medical doctor and who also works today, who was very aggressive to me because she said, "Why do you do such research? You are a medical doctor. You should beware our society of physicians. You shouldn't write so ugly things about our medical system, because they are all infective, or they all have infectious diseases, and we have to beware the society from these infectious diseases." You see some similar argumentation as we have today also, if you think about COVID, but completely different because of political systems. But there are similarities also. So you can see, I didn't find anyone who did resistance who was on the opposite side, and there were a lot of doctors. I cannot give you a number now, I had to pick it up, but more than 50 or 100 or something like this, yes.
You also can ask questions, let's say, online. Just unmute your microphone yourself and it will work. And I can tell that already now we have like discussion in between participants, like Egle, our young colleague from the Lithuania, asking, well, I also wonder why physicians did what they were asked, and Maria Kuzabayeva asking her. So anyone have online question, let's say, outside the chat, then we will return to the question from Daniel Haley. if not online. Florian, can you read the questions, and it will be easier to understand you from Daniel, Haley?
Yes, I can read it. I'm quite. Shall I read it again, or only
no, if
give
it's
answer?
clear for you, we can read, and just you can answer.
Give the answer. But then give me just a second to read it for my own. I'm quite puzzled by the very high number. Yes, this could be Daniel. Yes, Daniel, thank you very much for your question also. Yes, I'm also, as I first had the opportunity to get deeper into this story, I thought, yes, they were all infected by some infectious diseases, but as we had the opportunity then to get deeper into the archive materials of Leipzig, then we had the opportunity really to make our own impression and also to analyze these materials. And there is the number of 20%, as I explained to you. So only 20% were infected by gonorrhea. So this is a next argument or further argument that these wars has nothing to do with taking care of ill persons or ill females. These wars have something to do with disciplining or politicized medicine or instrumentalization of medicine by political power. You know this sometimes from prisons, yes, from political prisons, yeah. Also, you know this from Soviet Union, maybe. You know this also from other nationalities. But I didn't find this up to this time in the GDR. But the GDR has the spirit of the Soviet Union, so there could be some similarities. And I guess this has a lot to do with the Soviet Union and also the spirit of this. So they had the other opportunity would had be that they bring these women to political prisons. This would be the other opportunity. But in political prisons, first of all, there were men, not first of all women. And if you think about the integrity of a female body, I think this has a lot to do why they choose these venerology wards with this torture of taking these smears every morning, yes, to violate them. I wrote this, or I found this, or I formulate this as a sort of sexual torture against women, what was done here in these wards. So I think it's a very hard torture against women, and it was part of this politicized medicine and of this dictatorship in the GDR. But it's absolutely right to ask this question. For me, it was very impressive that we found only 20% of them are infected by gonorrhea. Okay.
Yeah, Daniel, any comments? And
yes, please. Yeah. May I comment?
Yeah, Alfredo.
Thank you, Florian, for your very interesting lecture. I just wonder what happened if it were about therapy, because I think it deserves an answer about the therapy these doctors were doing in this kind of segregating prison in DDR. I mean, was there an individual action or a scheme going from the Ministry of Health and of the Ministry of State Security about the therapeutic tools? According to my knowledge, in Berlin, immediately after the Second World War, venereal diseases were treated by the general practitioners still giving salvarsan and not using penicillin, just for economic reason, just because when you treat with the salvarsan, you have the patient under control for a year or a year and a half. If you treat with penicillin, of course, it is a control of only 1 week or 10 days, that's all. So, and the other question is how the doctors were selected to run this kind of medical prism. Thank you.
Yeah, thank you very much, Alfredo, for your both questions. In fact, they had penicillin also. It was just an economic question, as you described it. They had the opportunity to give them salvarsan or penicillin. They had both of them in the GDR also. So we checked this also for these cities in Halle, Leipzig, or Berlin. Do they have penicillin also there in the city? Was there something available in this time? Yes, they had, but it was more expensive. Yes, so they could take first of all salvarsan and then penicillin. But we had these in these materials we had from Leipzig. We have these 20% who were infected, and then we got through the record and we saw they gave them penicillin. In fact, so in these years they got penicillin if they were really infected by gonorrhea in Leipzig, but some of them got also salvarsan. So you are right, and this is a question of the economic situation. So, but some of them got it, yeah, and they had it in fact, so they could give it if they like it. And your second questions, I'm not sure if I got it right, so maybe you could just repeat it.
I just would like to know how the doctors were selected to run this kind of medical wards.
Yeah, it's quite interesting questions. I cannot say so much about these medical doctors because first of all, my first interest was to characterize the patients or the women or victims, yes, not the medical doctors. So my power was first of all to characterize these patients and because they are victims. But we started also to characterize the medical doctors, and first of all Gerd Münks, who was chief of this department in Halle. And this is very interesting because this has something to do with continuity of elites, yeah, Elitenkontinuität. Gerd Münks was someone who was also in power during Nazi regime. And then he got a position also in the GDR in the healthcare systems. So it could be that there is a continuity of elites also between Nazi regime and the GDR. I'm not sure. This is a hypothesis. Yeah, this could be. Yeah, I can say for Gerd Münks, the chief of Halle, this is. So it was a personal interest from Gerd Münks. Yeah, he is very cruel. If you get deeper into the records of Halle, you will see that the women wrote also about Gerd Münks, and also the police was well informed about the cruelty of Gerd Münks. So he was personally interested in doing such cruelty against women. He was interested in torturing these women. So it was mere intrinsic motivation. And from outside perspective, there is continuity of power in healthcare systems. But we have to do more research to give you, Alfredo, a better question to your answer. Yes, I can only give this for one medical doctor.
Okay, I think the both parties are satisfied, and of course, we have quite intensive chat, and already online is Anastasia with question and comments, and I see interesting colleagues from DAO. Were there any death cases in these facilities in German Democratic Republic? Yeah, can you comment probably? Yeah?
Hello, I'm Jiao from Žalnora University. Thank you for a wonderful lecture. I like it very much. It's very cool. And I want to say, were there any like direct death cases inside of the facility, the GDR? And you know, the women or other patient, you call it patient, suffering in this facility, they probably have some psychological trauma. So they're gonna, I think their mortality rate after this, do you have the data or something? Maybe you can just tell us.
Yeah, thank you very much. Very interesting, and greetings to Žalnora University also. Yeah. No, I didn't find any suicide. I didn't find any normal deaths or murdered deaths or something like this. I didn't find these miscarriages. I did find, yes, from pregnant women, but only a small number of miscarriages. But there are miscarriages of pregnant women. Yes, there are, but no, there's no suicide rate. There are no deaths documented in the material. There could be, I'm not sure if there is some, but I asked this also the medical doctors and the nurses who came to me for oral history, and I asked them exactly these questions, and no, none of them could give me an answer in this. And there's no finding also in the materials, in the archival archives or in the materials stored in the archives. So I'm sorry, no, there is nothing.
Thank you.
Thank you. So Anastasia Zaplatina is waiting for a long time. Anastasia, please ask your question or comments. Yeah.
Yeah, thank you so much for your presentation. Yeah, I'm writing my dissertation about neurology in Soviet Union at the Bielefeld University now. So I have several questions or comments. I think it's not a big surprise that there was a special attitude or a special prejudice against women and who expressed their sexuality, and we know a lot of like punishment of women who were rape victims after the war and so on. So I think that this story actually relates to this deep roots of gender prejudice or like special female. But my question is actually about the doctors, yes, and I think that you compare them like with Soviet medicine, but I think the most of them were educated or started working during time, and maybe it makes sense to compare with the National Socialism period and this tradition of treating women and special attitude to women and so on. And also, as far as I know, in Soviet Union, there was like a criminal punishment in the criminal code for transmitting the venereal diseases. And what I do, for example, I look through the criminal documents in archives. So maybe in your case, it also makes sense to do this, to like know the statistics and how many, like maybe women or men or ages or whatever, how long they were accused, because you mentioned that there was the same kind of punishment in GDR this time. Yeah, so that was it. Comments,
yeah. Okay, thank you, Anastasia. Florian, you have new partner, let's say, to your project. Very good, yes. So, any comments from your side, Florian?
Yeah, thank you very much, Anastasia. You're invited coming to Ulm if you like. It's not far away from Bielefeld, and we can discuss it also with my team. I have one wonderful female co-worker, Oksana Kosenko, who started with me doing some research now in Russia. Just to do exactly what you proposed. Yes, so maybe we can discuss it also. And you're absolutely right. These are female prejudices. Yes, this has something to do between females and male, but it's also it's hard to accept these prejudices also for the GDR. I'm not sure if there's a continuity line between National Socialism and GDR. I have only some impression of it. So we have to do more scientific work to give hard evidence for this hypothesis.
Mm-hmm. So thank you. Please, just very short question from Joel Donchin. When those institutes finally were closed, he asking particularly about in GDR, yeah, when it was in 89 or?
It depends on the city. If, for example, in Leipzig, 1981, in Halle, some years earlier, and in Berlin, also in 1980, in the late 1980s, in Dresden, in the late 1970s. So it depends on the city. Some of them really up to 1989. Some of them were closed earlier. And it depends on the local situation. It has a lot to do with personnel, with the staff situation, with personal influences, and so on.
Mm-hmm. Okay, so when we discussed in August, I really was surprised. Actually, I know the German Democratic Republic from 85. I was the first time. And for me, it was big shock that, let's say, everything what was in the Soviet Union, maybe this was overplayed or so extreme in the German Democratic Republic. So I have such a feeling that it's okay, it's a great country, probably #2 in terms of economics after the Soviet Union, but at the same time, it was like a country without identity. They a little bit like lost. Yeah, probably that is the answer. But I'm very happy to invite you to answer to Ineta Lipša from Riga, from Latvia. Question, actually, I know that you are partnered, you're already writing common article, and Ineta doing quite the same. And her, can you read her question, or Ineta, would you like to ask this question yourself? Florian, you can. Yeah, Ineta.
Yeah, you see my question. Yeah, thanks, Florian, for the research you have done. I already told you about it in August, but now I have only one question I would like to ask, because we have already talked a lot of. And could you please tell why did you decide to characterize the politicized medicine in the GDR as having a spirit of the Soviet Union? Because I'm asking, keeping in mind the context of Soviet Latvia, and I mean that in Soviet Latvia there was no such attitude towards only one gender, and both genders were under scope. But on the contrary, before the Second World War, in the democratic interwar Latvia, the attitude was similar to that of the GDR. Could you comment on that?
Yeah, thank you, and hello, Ineta. Nice seeing you. We will do some research together, maybe, because we found some similar word also in Latvia, in Riga, in fact. So we will try to understand what happened there, Ineta, and we'll do this together with me. But now to your question, yes, you are right. It is not only an idea. If I wrote these records and found some comments also from the doctors on the side of the personal records, the patient records, but also on the administrative materials given from Berlin to the cities and also to the doctors, we found always some belongings to Soviet Union. So they had in mind what happened there in Soviet Union, also in the medical system, and they commented this. So, for example, if they asked the medical doctor in Halle or Leipzig or in Berlin to do something, the Berlin political system or the minister, they always made some link to the Soviet Union. So we found something what was commented by, in fact, GDR men and women, but they had they made some link to the Soviet Union. And so I thought, I believe this has something to do with Soviet Union, but to make it really clear and to give a really good answer, we have to compare to these both systems. I tried doing this since 8-9 years, and it's extremely complicated to get material from the Soviet Union time, yes? So it's really extremely complicated to do this. So if you think we should discuss this more in a more differentiated or more complex. Yes, I'm very happy doing this, but I have, I believe, or I have a feeling that this has to do with Soviet Union, because there are these links, and they cite also from official materials from Soviet Union. So it could be in practice, in fact, different, yes, but in a normative way, I think it's very close, because you have this citing, these citings, and also these normative links between these two nations.
Thank you.
So thank you, Ineta, for your question and comments also. And Florian, we have a question from colleague Siangu. Just a short question. I wonder how many of doctors were men and how many were women?
Very interesting question.
Simple question.
Yeah, simple question. I think it was balanced. If I have just to go through these cities, yes, I think it's gender balanced. So you will have 50-50, maybe a 52 and 48. Also, no, it's gender balanced. So it is the same number men and the same number women.
Mm-hmm. Okay. Before I'm asked for every positives that yes, we recorded this session and we will post it. It's later. And the last question, let's keep like 1 hour format, so half an hour lecture, half an hour discussion. So Florian, can you see the last question from Bo Chow?
Well,
yeah.
Yes, it is. In fact, it is. The GDR Ministry of Health is responsible. This is right, absolutely, because they are very well informed also. Yes, you know, because they have these reports from the secret policy also. We have also stored this material in the archives, and we can find they are very well informed what's happening or what's going on in Halle, in Berlin, in Dresden, what else. Yes. So they could stop it if they would like to do this, or they couldn't, and they didn't anything to save the women from this torture. So yes, in fact, they are responsible. That's absolutely right.
Okay. Yeah.
Thanks.
Yeah. So guys, thank you very much. I think we will finish our first attempt, our first, let's say, International Congress of the Society of History of Medicine, let's say, pilot online lecture. We will do the second attempt on 22nd of October in the same time and in the same format, actually, because we also have recorded Dr. Marcin Orzechowski's lecture about the politicized medicine in Poland, yeah? And then we will see, we will decide it. Probably we will go further. Maybe you would like to participate with your let's say research, and or we will probably switch the topic and we will have online lectures about another topics. Thank you very much. I can summarize that around 50% asked to was ready to participate. During the today 1 hour conference, we have around 30 participants. Somebody appeared, somebody left, yeah. But thank you very much for your active involvement, and I believe that our first attempt was very good. And thank you very much for Florian, for you, and for great experts, Ineta, Aistis, and you all are great experts. And thank you very much. This event happened. Have a very pleasant evening and see you in 2 weeks. Thank you. We will publish, yeah, it will be on Congress website, the link for this, the full conference. Thank you.